Today I want to discuss the clinical utility of the autism diagnostic interview and the autism diagnostic observation schedule. These instruments were developed in a research context and really were for specific kinds of research. Unfortunately, they've been transferred to clinical practice with unforeseen consequences. When you use narrow instruments like this, and it was done in by Gillian Baird in her study in the southeast of London, published in the Lancet, you get a prevalence of autism of about 25 per 10,000, and when you use the broader autism phenotype, a clinical diagnostic interview as suggested by the National Institute of Clinical Excellence, you get a diagnosis of 116 per 10,000. The tragedy is that so many children are therefore deprived of a diagnosis of autism if you use these narrow instruments solely as for diagnosis of autism. It is not surprising that the International Meeting for Autism in London in the past, senior autism researchers lambasted these narrow instruments for missing many cases of autism, and this is published in Adam Feinstein's book on the history and autism. Dorothy Bishop at the University of Cambridge told Adam Feinstein that if it could be shown that there were real benefits in accuracy of diagnosis from adopting this lengthy procedure, then I'd be happy to say okay. But she went on to point out that the originators of the instruments have never demonstrated this. It's really more an article of faith with them. In actual fact, the current prevalence of autism is about 1 in 59, and that's from the Centre for Disease Control in 2018, when I was involved with Paul McCarthy and Marianne Smith doing the first prevalence of autism in Ireland. We found 4 per 10,000, and of course this was a huge underestimate. If we're concerned about children, then the correct, in my personal view, from a clinical perspective, rate of autism would be about 1 in 59. Some of these will have mild autism, very mild autism, but what I tell my patients, this is far from trivial, and sometimes people use what I call an abusive comment here. They call these light autism. They might be light autism, but they're certainly not trivial, and they do need help if the child is going to develop as well as they could and achieve their full potential. Psychiatry nowadays, it has moved from a tragic period of blaming the mother, that was the so-called abusive refrigerated mother, schizophrenic mother, mother given double bind commands. All of these notions are complete nonsense, and our understanding today is that all these conditions are neurodevelopmental disorders. The blaming the mother has absolutely no place. Heritability, for example, in autism does vary from study to study, but it's approximately 90%. It has nothing to do with the style of parenting of mothers. One of the great tragedies is that the originator of autism in modern times was George Frankl. He worked in Vienna. He gave the idea to Hans Asperger. Then when Hitler came, he moved to the United States and gave the idea to Kanner. He had a broad concept of autism, but tragically Kanner created a very narrow concept of autism, who excludes a huge number of people with autism today. And the tragedy is that these people are not, these children and adults are not getting the treatment they require, and so are being effectively seriously disadvantaged, full stop. One other problem with ADI-ADOS is that if they're not reflecting autism in the general population, then what are they reflecting? Does this mean that studies using the ADI-ADOS will need to be redone to reflect autism in the general population? Of course, it is true to say ADI-ADOS, they do reflect the points on the spectrum that they identify, but one cannot extrapolate from the ADI-ADOS population to the general population of persons with autism, which in some ways totally undermines the situation. So that both from a research point of view and indeed from a clinical point of view, there are serious problems with these instruments, which have been recognized for a long time. The only way to understand autism is to diagnose a lot of children and adults with autism. I've diagnosed about 5,000, and there is a clinical gestalt that one has that you feel based on experience, which gives you the best possible diagnosis of autism. Indeed, the gold standard is the clinical diagnosis by an expert.